India is simplifying the visa systems for medical travelers, expanding international outreach, and positioning healthcare as a strategic export sector. I now request Ms. Sunita Reddy, Managing Director, Apollo Hospitals, to kindly. And ladies and gentlemen, let's put our hands together to welcome Honorable Minister Sir Shri Piyush Goyal ji for the inaugural address. And before we invite the Minister, I would invite Ms. Sunita Reddy to kindly set the context for this session. Over to you, ma'am.
Namaste and good afternoon. Very warm welcome to the man of the moment, Mr. Piyush Goyal, our Honorable Minister Piyush Goyal. Thank you very much for making time to be here. We know that he's in the middle of trade talks. He's in the middle of a meeting of several ministers that he has planned for today, but he still made time for CII, and he made time for this very important subject, which is medical value travel. Just to set the context, I think, I have to outline the scope of medical value travel. If you look at medical value travel today, it is a $100 billion industry. In that $100 billion, Thailand gets 25% of that. And really my question to all of you and my challenge to myself is how much of this $100 billion do we deserve to get? And I say deserve to get because I think India has the best medical systems. We're at 1/10 of the international cost. We have an integrated health system with Ayurveda. So in terms of dealing with chronic, in terms of dealing with wellness, we have a value proposition that no one else can beat. As we look at the rest of the world, we know 3 reasons why people are coming to us. 1, shortage of beds, and therefore all of the African countries and our surrounding neighbors. The second, the potential, is the waiting times in UK, the cost of care in US and the Western countries. These are 3 primary reasons why people should come to India for care. Now to look at how we will make sure, what is the strategy ahead, and how we can work with the Indian government to achieve the goals not only of Heal in India, but to make sure that India is on the path of Viksit Bharat by galvanizing this economy, which means not bringing just $10 billion of revenue to medical value travel, to Heal in India, but also creating an ecosystem with a multiplier effect that will create jobs, that will create more travel and tourism, and will benefit the population at large, because this, I believe, is just the beginning, and we are truly honored to have the minister here. So with this, let me hand over to Dr. Naresh Trehan for his remarks.
Ladies and gentlemen, I now invite Dr. Naresh Trehan for the welcome address. Over to you, sir.
Thank you. Good afternoon. And I must thank our dynamic Minister for Commerce, Mr. Piyush Goyal, to really take out that 20-25 minutes and out of his schedule, because there are meetings before, after, tonight. So I know how hard he works. So I'm not going to give a big introduction, but because he doesn't need any. But I'm just going to make a couple of remarks that we all know that India is poised in the best position to be the destination for medical value travel. Unfortunately, because of various disconnects, we have not achieved the potential that we can. And we need to actually get a champion for us from the government who can iron out all the little kinks that are coming in the way. And we also on our side as the providers must actually connect ourselves in a way that only the patients who do come do not suffer in unrecognized places, because right now it's a very chaotic system and not everybody is getting the best experience that they should with the value that they can get from India. So let me request the Minister to please enlighten us. And the second thing I wanted to say was that I have spoken to the Minister and he's kindly agreed that he will be the champion for medical travel, value travel from now on. So you have your task cut out. Thank you so much.
Thank you very much, Dr. Trehan, Chairman of the CII Healthcare Council, and of course, somebody we all look up to as one of the finest doctors in India, one of the finest surgeons in India, and truly a champion of India's medical sector, a person who even at his age, which probably looking at him, very difficult to imagine, and if you shake hands with him, you've got to be worried कि हाथ ठीक ठाक है कि नहीं बाद में. He still has a military handshake. Truly wonderful human being. I've seen him work during COVID. I've seen him work through very, very tough, trying times. And I'm glad that he's taking so much interest in this subject, something which is dear to all of us and truly holds tremendous potential. Ms. Sunita Reddy, of course, has been at the forefront of serving this cause over the years. The Apollo Hospitals has been an iconic brand in India. They're well entrenched across the country to lead this charge to promote medical tourism. And I have no doubt that with this kind of leadership, we'll be able to achieve some wonderful results. Mr. Pramod Alaguru from the Manipal Health Enterprises, my good friend and colleague in the government, Vaidya Rajesh Kotecha, Secretary of Ministry of Ayush, which looks after traditional medicines and the scientific validation that's required to promote our traditional medicines across the world. All the distinguished participants of this 22nd Annual Health Summit 2025, friends from the media, ladies and gentlemen. Truly a very, very difficult day, yet very prophetic to be meeting all the medical professionals today. Only yesterday we had this tragic bomb blast at Red Fort, where we lost 10 lives. Many of our brothers and sisters are injured. Shows us that we all have to be very conscious about the safety and security of our environments. We've got to be very careful about terrorism rearing its head again. And there are these last-ditch efforts that these terrorists do to try and show their relevance. We as citizens, we have as 140 crore Indians, I think are duty bound to really give a very, very responsible yet firm answer to such characters. I'm told you've had a condolence message in the morning. You all already stood in silence for conveying the condolences of all of us collectively to the families of the deceased, and our prayers for those who are injured so that they recover fast. But in that context, if one sees and we see the contribution of all the doctors, the medical profession to ameliorate some of these problems, you really are playing a very important role. In fact, even yesterday, it was the doctors who gave immediate emergency care at the Loknaik Jayaprakash Narayan Hospital where the injured were shifted. And therefore, this kind of first responder critical care service that you give is something that really the nation and all of us are very, very proud of. We cannot forget the COVID period where, of course, the profession really shown outstanding performance. You outperformed, in fact, even everybody's expectations, putting your own lives to risk, yet were ready to make sure that you could save every single life that was possible in the circumstances. So as a nation, I want to tell you that we are all very grateful and convey the gratitude of 1.4 billion Indians to the medical profession for the human service that you are doing to the nation, to society, and to all of us. In fact, Prime Minister Modi had said, and I'd like to quote, "Good health is the foundation of every thriving society." And if India has to become Viksit Bharat 2047, a developed nation, a prosperous nation, when we celebrate 100 years of independence, the role of our doctors, the role of the medical profession as a whole, nurses, technicians, all the ecosystem, the medical devices manufacturers, our traditional medicine professionals, the entire ecosystem is going to play a very important role. And therefore, we will have to provide vision and leadership. And no better persons than the illustrious team sitting on the dais today and all of you to provide that leadership so that India provides world-class healthcare, becomes a global benchmark for quality care, for quality surgeries, for quality pre and post medical care, for quality preventive healthcare, and of course high-quality traditional healthcare. Towards that end, we are finding that India's consumer healthcare spending is also going up. The government's healthcare spending is also going up. I don't know if you have noticed that when this government came in 2014, we had only 7 All India Institutes of Medical Sciences. And across the country, we had only 387 medical colleges. In the last decade, we have been able to grow this to 23 All India Institutes of Medical Sciences. So 16 added in a decade against 7 set up over so many decades. At the same time, 387 medical colleges have almost doubled to 706 medical colleges today. Because we recognize that we need more doctors. We recognize that India is also providing a talent pool of highly qualified professionals for other parts of the world. And we also recognize that our own requirement as a large nation is so large that we'll need more and more doctors. In fact, last year, from the ramparts of the Red Fort, the Honorable Prime Minister announced that we'll be creating a very significant number of medical seats in the next 5 years until 2029, so that the output of doctors who come out of medical colleges can increase significantly, and we can utilize our medical infrastructure smarter and better. Many of you are aware we have Ayushman Bharat, almost 700 million people eligible for free healthcare. Every senior citizen above the age of 70 is eligible for free healthcare, irrespective of income. And I remember asking the Prime Minister, why should we be doing it for everybody? The rich people can kind of take care of themselves. You don't need to do it for everybody. And see the compassion in the man. He told me, nowadays we find a lot of cases of even rich families who don't care for their elders at home, as we used to have in traditional India. And there are some very bad examples which have even come out in newspapers and reported, where people have not looked after their parents or the elderly in the families, as India was known to do for centuries. And therefore he said everybody above 70 should have this social security net, or the comfort that he or she will be taken care of. Even Jan Aushadhi stores have been a grand success. 10,000 of them and growing, providing generic medicines at very affordable prices, even sanitary pads for our less privileged sections of society at barely 1.5 rupee each, so that for $1, only $1, a woman will get menstrual facility of sanitary pads throughout the year. And I think it is these small, subtle interventions that really are impacting the healthcare of the citizens in rural India, of the people, less privileged people, the people at the bottom of the pyramid. And one thing that why am I giving this context when we are here to discuss India's medical value tourism? I think it's important to recognize that we can't have such a chalk and cheese system where the local people will not be eligible for healthcare and our health facilities will be focused only on international medical value proposition. And therefore it's important that we ensure that 1.4 billion Indians get quality healthcare, get access to affordable healthcare. So that when we look at medical tourism or medical facilities being available for international people to come and take the service in India, also add to India's GDP, add to India's foreign exchange income, our exports, it's only possible because we have been able to create this foundation of affordable and quality healthcare for every citizen of India first. Given that we have created this foundation, given that today India's healthcare credentials as a fit nation, as a nation which recognizes the importance of providing healthcare to every citizen, a nation where you have seen in the recent GST cuts, a focus has been on health insurance, life insurance from 18 to 0, a number of medical devices brought down to 5%, a number of medicines brought down to 0 or 5%, cancer care, drugs and other things like that. Ms. Reddy was just telling me maybe we should look at some more medicines being available at affordable prices through reduction in any other duties or cesses. We'll be happy to hear more specific details from you so that we can give it a consideration. I can assure you, friends, this is a listening government. And we are happy to listen to your voice, to listen to your suggestions, to listen to your ideas, because all of these will cumulatively help us both to serve the Indian people and to promote medical value travel. Also, the idea about visa on arrival that you have been articulating, Dr. Trayan has been at the forefront, Ms. Reddy, is a good idea. We'll pursue that. It's, of course, one will have to look at what the certifications will be and which are the countries where we can allow that. So I'm happy to tell you that many countries we allow visa on arrival, or we allow e-visas where you just apply online and within 24 or 48 hours you get your visa. Both these can be considered, let's say, for the United States, for most of the European countries, not all by the way, for most of the countries where we have a fair amount of comfort, where detailed investigations or inquiries are not required. So let us prepare collectively. And these are the areas where maximum, or at least let's say reasonably value-based tourism can come in, or medical tourism can come in. So let's work together. CII could put a team together and study the market. You said it's a $100 billion market. My figures suggest that it could be over $800 billion market and expected to become a $1 trillion market, including wellness, medical wellness or health fitness or health precautionary preventive care. Now you are really looking at a huge, colossal business possibility with India's share being minuscule. And let's aspire to go big on this. Of course, we've not been able to achieve that as yet, because possibly the infrastructure is not good enough. Possibly we may need to make some amendments to our regulatory practices. Another thought that came up was whether we could allow NRI doctors to come and also work in Indian hospitals. Very often patients are very comfortable to have their own doctor to be operating on them or to be available when the operation is taking place or any health intervention is taking place. Again, we are open to that, but you will need to first get your Indian Medical Association, the IMA, on board. That's something that all of you should really be collectively working on to get IMA to give this proposal. Because all these professions are regulated by, like chartered accountants, we are regulated by our institute, you are regulated by IMA. And I think they will have to, or the medical council, they will have to come to terms and come to accept this. Each profession, the lawyers don't accept foreign lawyers to come into India, except for fly in and fly out. I don't know about doctors. Possibly we could start with fly in, operate and fly out to begin with. So we need you and leaders from the industry to help us work with your regulatory body. And I can assure you the government will not be found wanting if the profession is on board. And if you need our help to try to bring consensus, we are happy to even attempt that. At the same time, one must recognize we have a great advantage of 2 or 3 things. Young population. So we have a lot of youthful talent and skill which we can offer to foreigners coming into India for medical treatments, both preventive, wellness or curative. We have an advantage of huge skill sets of our doctors, our technicians, our nurses, our caregivers. In fact, some of our nurses and caregivers have a very high premium value. There are countries who are willing to take in our nurses and caregivers at phenomenal salaries. We need to upgrade the nursing programs. We need to upgrade the number of nurses that are prepared in the country. In fact, I would urge as many hospitals in the country of repute, Manipal, Apollo, Medanta, Fortis, Max, all of you all. In Mumbai, the Harkishan Das, Kokila Ben, Bleach Candy. I think you need to get all the hospitals on board. Maybe you need to have the administrators or the trustees of these hospitals sit down, the main hospitals, and work out how can we increase the nurses' output by maybe 100,000 nurses a year. Because that's the level of demand in the world for our nurses. And I suspect if we are able to develop medical tourism in India, we will need that level of nurses and high quality nursing care for expanding our medical tourism. We already have a shortage of nurses and caregivers. And given the aging populations in the rest of the world, some parts of the country, some parts of the world have 47, 50-year-old average age of population and growing older. Can you imagine what a massive opportunity awaits us? Then we have countries where medical treatment is given as a part of the social welfare spend, but there are huge waiting times. So even to get a dental appointment may take you 6 months. It's probably easier to fly in, get the treatment and go back. Faster, less cost, and possibly better. And there lies an opportunity. So let us, I hope this health summit that you're holding today will come up with an action agenda. Some of which you have mentioned, some more may come out in the course of discussions. What infrastructure facilities, what stay facilities. For example, every treatment may not be in the hospital. I'm sure hospitals wouldn't like to just clog themselves and book up all the rooms for foreigners so that we Indians don't have a place to go. We'll have to have some kind of balance between the needs of India and what we are able to offer to the world. We can't have an open sesame that whoever pays the highest money has the right to the hospital facilities, because those hospitals are built on India Indian land, Indian infrastructure is being used. Doctors who studied here, who on home government and country and the people of India spent crores of rupees to train. We can't have all of them only treating the foreigners. So that right balance will have to be thought through. And you will have to come up with a cogent proposal that, okay, can hospitals be allowed up to 10% of foreign patients? And against that, what will be the benefit that will be given to the poor patients? Will all of these hospitals approve or agree to be a part of Ayushman Bharat program? Will they all agree to give the poor as a part of CSR or whatever formulas are there? Will they be allowed to give, or will they assure that they will share a part of the higher earnings from foreign medical treatments to serve the less privileged sections of Indian society? And it'll have to be some balance that we will have to create. And then I can assure you, given the good high quality that India has, the affordability, possibly a treatment here would be done at 1/4 or 1/3 the price that would be required anywhere else in the world, possibly even less in some cases. You said 1/6. I think our competitiveness is there, our quality is there, our competence is there, our skills are there. Few more enablers, some from the government, some from your medical council or medical association, some from collectively the doctors and hospitals working to partner in this initiative. If we all work together in this, I think there's a huge value proposition awaiting us. I can assure you the government is very committed to supporting this program that you have taken up. I think Heal in India could also combine yoga, Ayurveda, yoga with meditation, pranayams. Possibly we could also look at a mix where modern treatment coupled with traditional medicine can help patients recover faster. I still remember I was in New Zealand last week and they were explaining to me Maruka honey. And they were explaining to me the health benefits of Maruka honey. Not just when you consume it, but for surgeries. I believe it's excellent as an antiseptic. And then I remembered that way back in 2008, I had undergone a serious surgery which went wrong at the first stage. And somewhere along the line there was some goof up and it was getting very, very bad. And I landed up at Dr. Udwadia's place. Somehow, for some reason, the surgery was done somewhere else. And it created problems. And then I had to go to Breach Candy Hospital and come under the care of Tempton Udwadia, not Farooq, who's the late Tempton Udwadia. And he started treating me and he gave a list of things to be brought for alternate day, or probably initially every day and then alternate day bandage. And amongst the things was honey. And he specified Australian honey. He didn't use the word Manuka. I remembered all this only last week, so it's fresh in my mind. And we got some honey. And there were some other ingredients. Cow's ghee, I think, was one of them. Cow's ghee and honey and whatnot. And when we got the ingredients, he looked at the honey, said, there's no good. And he gave some other specifications. So we had to get another bottle of honey. All of that was sent to, I think, Parsi General Hospital or a Parsi hospital in Breach Candy. Near Breach Candy Hospital, there's another hospital, probably women's or children's hospital, where he sent all of these ingredients. They made out gauges with all of these ingredients, which we got in a bread. I had also to take a bread basket, bread box, in which these gauges were put. They were lying in my refrigerator, and every 2 or 3 days he would come and, I would go to the hospital and he would change my bandage. And that's what cured me. So a mix of modern and traditional can do wonders. And guys in New Zealand are selling me Maruka honey, telling me it's very good for your doctors, as we were finalizing our free trade agreement. So that is the potential that India holds. I think Shushruth was the person who probably invented surgery originally in the world. So, and because I remember Dr. Tempton giving me all this gyan and saying this is how Shushruth had used to treat patients and cure them after post-surgery. So I think there's so much that we have in India. We need to leverage it. We need to link also possibly a medical tourism idea, a medical value proposition idea with spiritual tourism, where we could have meditation and Ayurveda and yoga and all of these things thrown in. So we can really package India very smartly. We can position India as a country where the basic ethos of healthcare is not new. It's been there for generations, for centuries. I mean, I'm not going back to Hanuman getting the jadi booties to treat Lakshman. So for us, it's something which comes naturally to all of us. And I have no doubt in my mind that let's take this project up swiftly. Let's take this project up in a smart manner. Let's take it seamlessly across the country. And let's keep it simple. So this is truly an area where you have our full support. We have the clinical prowess. We have the wellness heritage in India. We have a lot of talent. And we have that culture of hospitality. I think the right heady mix that is required to make India the #1 wellness destination of the world. My best wishes to your deliberations during the course of the day. And I'm sure I'll hear back from all of you with a full program of how we are going to take this in a mission mode, in a time-bound manner, and what are the critical interventions that we as government can do to partner you in this very, very wonderful initiative. Thank you very much, ladies and gentlemen.
Ladies and gentlemen, as already announced, Honorable Minister Sir has to leave. I would request Dr. Trehan to present a small memento, sir, a token of gratitude to the Honorable Minister Sir. Ladies and gentlemen, once again a huge round of applause for Shri Piyush Goyal ji. Honorable Minister Sir's commitment is clear. India must evolve from being a medical treatment provider to being the world's most trusted healthcare partner. Thank you very much indeed once again, sir. And ladies and gentlemen, we are honored to have with us today Honorable Secretary, Ministry of Ayush, Government of India, Shri Vaidya Rajesh Kotecha ji, who is a distinguished Ayurveda expert and administrator, has led India's global Ayush outreach. Under his leadership, India has signed multiple international MOUs, created the WHO Global